66-year-old male patient is brought to the emergency department by his wife. She reports that he suddenly developed weakness and slurred speech after mowing the lawn. You notice right facial droop and slurring of speech. You immediately take him to a monitored bed. You take his vital signs and note the following: heart rate 90 beats per minute, blood pressure 90/50 millimeters of mercury, respiratory rate 16 per minute, oxygen saturation 96%. What is your preliminary diagnosis of the patient? A, B, C, D. Correct answer, A, stroke. The wife's history of the event and your brief assessment using the FAST acronym should make you suspicious of a diagnosis of stroke. The cardiac monitor shows a sinus rhythm without ectopy. He is alert but continues to have slurred speech. What is your first course of action? A, B, C, D. Correct answer, D. Perform a brief general assessment. Within the first 10 minutes after arrival to the ED, the team should stabilize the patient and perform a brief general assessment. Attach the patient to a cardiac monitor, start an IV, perform a brief neuro assessment, and contact the stroke team. You determine that the patient is stable, and you order a CT scan of the brain. The stroke team arrives and performs an in-depth neurological assessment. The in-depth assessment by the stroke team should happen within how many minutes after arrival to the ED? A, B, C, D. Correct answer, B, 20 minutes. The National Institute of Neurological Diseases and Stroke criteria specify that the stroke team should do an in-depth neurological assessment within 20 minutes of arrival to the ED. During this assessment, the team should determine when the symptoms started. The patient is transported to radiology for a brain CT scan. The CT scan and definitive diagnosis of ischemic or hemorrhagic stroke should be completed within how many minutes after arrival to the ED? A, B, C, D. Correct answer, C, 45 minutes. Nine's criteria specify that a diagnosis of hemorrhagic or ischemic stroke based on the CT scan should be complete within 45 minutes after arrival to the ED. The team determines that the patient has suffered an ischemic stroke. You know that the treatment to be considered for this stroke is A, B, C, D. Correct answer, A. Fibrinolytic therapy should be considered for a patient with ischemic stroke. Surgery for evacuation of the hematoma is considered for a hemorrhagic stroke. You determine that the patient is a candidate for fibrinolytic therapy. You speak to the patient and family to explain the risks and benefits. They agree to the administration of rtPA. The rtPA should be administered within how many minutes after arrival to the ED? A, B, C, D. Correct answer, A, 60 minutes. 9's criteria specifies that the fibrinolytic should be administered within 60 minutes after arrival to the ED. The team administers rtPA and the patient remains stable.